My name's Andrew Chambler. I'm an orthopaedic consultant specialising in shoulder and elbow surgery. People's sort of wear and tear around their shoulder, and particularly their tendons, occur. And there's lots of treatments that we can do, ranging from steroid injection through to other sports med type of plasma, platelet-rich plasma injections, and then on to keyhole surgery again to make more space for these tendons. And if they do tear, then we can also fix them. There's some interesting new developments which here at the Bath Clinic we are able to offer for certain types of tendon injuries, where we are using a new bioinductive implant that is there that helps the tendon itself regenerate, which is very interesting. And then obviously the elderly population, when the joints finally wear out, like hips and knees, we can offer total shoulder replacements. Patients that have arthritis as well as torn tendons, we can put in a special type of implant that helps them get back their function as well as reduce their pain. As shoulder replacements are getting more advanced, we're starting to use navigational computer-generated navigation to help us produce better results with these patients, who are then able to be guided in with the help of the computer live during surgery to give better results from that type of procedure. So the typical patient pathway would consist of either the GP referring them in, either on the NHS or privately through self-pay or using their medical insurance, or we often get quite a few physiotherapists asking for our opinion once they've been seeing their patients in primary care. They then see us in outpatients, which we will then take a detailed history and examination and review their investigations if they've been sent to us, or we can organise that here in terms of x-rays, MRI scans, etc. And then back with us to go over those results to discuss their management options. Quite commonly they will come in just for a day case type procedure, come in on the day, in the morning or in the afternoon, for the afternoon lists, have their operation, be seen by the physiotherapists afterwards, check that they're comfortable and they have their post-operative instructions, and then they'll be discharged later that day. Most people, if they're doing day case work with keyhole surgery, that they can they'll be in a sling for about a week or so and then slowly start to get going. Some bigger work that we do through the keyhole, such as tendon repairs, do take a bit longer, and they'll commonly be in a sling for 3 weeks before then slowly mobilising. Although they have their operation on the day, it's still quite a big operation. But now we've moved into the keyhole type techniques as well as the advanced anaesthetic procedures that we can undertake for such as regional anaesthesia. They can get home, but it will take time for them to recover. The most enjoyment I have is making patients feel better. And quite often, the majority of times people come because of pain, particularly at night, say that they haven't slept for months, and then that ends up into the whole aspect of their life, both at work, being able to concentrate, trying to look after things at home without snapping at the children so much. And if you can take that away from them and they come in, they look different, they look refreshed, they have smiles on their faces, and that's what we do best. Enjoyment I get out of shoulder surgery is of the spectrum of the population that we can treat. So it goes right from the younger age group with their sports injuries through the middle age group, which has where the shoulder tendons are beginning to wear a little bit and interfering with their work and their more perhaps leisurely recreational pursuits, and we can help there. And then finally with the elderly, particularly with their arthritis in their shoulders. Quite often, some of them are trying to still live independently, and with a stiff, painful shoulder, that can limit that and threaten that in terms of them having to think about going into care homes, etc. And if you can take away their pain and increase their function of their shoulder, it almost gives them a new lease of life. Quite a few people out there are sitting in pain, and particularly at night, awaking in pain, and they do perhaps not or are not aware of all the things that can be offered. Certainly in this recent time through the pandemic, it's been very difficult to get to GPs because they've been very busy, and to sort of seek help to try and look for improvement of their quality of life by reducing their pain. And there's certainly a lot of things that we can do to help that.